Good afternoon, Peter Goertz. I'm a psychiatrist. When does a person need involuntary psychiatric hospitalization? They need to have a mental illness if they're a danger to themselves or others, if they're unable to care for themselves, if they're gravely disabled. So the first issue, all of them are gray areas. Even the first issue, mental illness, does someone have a mental illness or not? And then in addition to the mental illness, one of the other issues that I just mentioned, so danger to self and or others, inability to care for themselves or a grave disability. And unfortunately, again, these issues are gray areas. They're not black and white. And as a psychiatrist, you have the ability to make those decisions. So you have the ability to take away a person's civil liberties. The other side of that coin is you have the responsibility to really do your best to make a good decision in that regard. And we're balancing very important issues, freedom and safety, which are both key issues. And there's no protocol for a given situation and a given patient. So we want to use our best judgment, easy to say, of course. And there can be tricky situations. For example, a patient who comes in psychotic and you think it might be due to substance abuse, their urine tox shows methamphetamine, for example. That psychosis may resolve pretty quickly. So if it resolves quickly enough, they may not need to go to a psychiatric hospital. They may just be able to stay in the emergency room for a few hours until they are no longer psychotic. If someone is intoxicated with a drug or alcohol and is suicidal and or homicidal, the suicidality and or homicidality may resolve if the intoxication resolves. So a person like that may or may not need to go to a psychiatric hospital, depending on the time frame that it takes to have the suicidality and or homicidality resolve. If someone is autistic and agitated, that can be a tricky and difficult situation in emergency rooms because often psychiatric hospitals will not accept autistic patients and they can be very dangerous at home, but you have these patients at times in an emergency room for days on end, and at some point they're often discharged back to their homes. And that's tricky because these people can get quite violent, but our system, as I'm sure you realize, is far from perfect. If someone has intellectual disability and is agitated, they often may stay in an emergency room for quite some time. Psychiatric hospitals tend not to accept those patients either. And again, they may be discharged back to home or back to a group home, any residential setting, but they can also be quite problematic after they're discharged. So it's really a balance, and our system can be a difficult system to deal with. Pregnant patients can be problematic in the sense that we're limited in the choice of medications. If someone's pregnant, we don't want to negatively affect the baby. And let's say a patient comes in 30 weeks pregnant and is psychotic, then they may need quite a long psychiatric hospitalization because often it's a good idea to wait until the patient's ready to give birth before discharging her, or until the patient has given birth, until discharging her back to the community. So another situation that can be quite costly for the system, to hospitalize a pregnant patient psychiatrically for 4 weeks or so, for example. Collateral information, for example, from the family is key and can really help a lot. That's something I try my best to get, and that can really help me to ultimately make the decision whether or not a patient needs to be psychiatrically hospitalized. On the other hand, Collateral information may not be entirely reliable or not reliable at all. A family may have a financial incentive to have a patient hospitalized. So again, you want to get a feel for the situation as best you can. You want to listen to the patient, of course. The patient may tell you something like that, which may or may not be psychotic, may or may not be true. And another potential situation would be, let's say a husband wants custody of the children, the marriage is falling apart, and tries to have his wife psychiatrically hospitalized in order to gain leverage, in order to get custody of the children. A family can be quite demanding. So let's say you're tending to think that a patient, a child, let's say, needs to be psychiatrically hospitalized, and you discuss that with the family of the patient, and the family is very opposed to that and say, for example, oh, we'll have someone watch the patient 24 hours a day. That I would not rely on. So you want to really stick with your guns and do what feels right to you, even if the family is very angry. And you're going to want to set boundaries with everyone if necessary. So with the patient may demand to be discharged, say there's nothing wrong with me. The family may object to your decision to hospitalize the patient. The ER doctor actually at times may object to your decision to hospitalize the patient. So do what feels right to you is my recommendation, and get as much information as possible. And you may want to get collateral information if you don't really feel that the information from the family is that reliable. You may want to ask the patient, can I call a friend of yours? So get as much information as necessary and as much as possible in order to make a good decision. Now, when you tell the patient, let's say an emergency room patient who is potentially aggressive, potentially going to get agitated, when do you tell that patient that you feel they need to be psychiatrically hospitalized? I generally do telepsychiatry consultations. I see these patients via telepsychiatry. So I'm not going to be in physical danger if I tell the patient you're going to need to go to a psychiatric hospital, in my opinion. But other people in the emergency room might. Plus, I'm not the one ultimately making the decision because I'm a consultant. If I'm doing a consultation on an emergency room patient, the ultimate decision maker is the treating doctor, so the emergency room doctor in that situation. Whether I see the patient via telepsychiatry or not, I'm just a consultant in my current job. So when to tell a patient, I gauge it as best I can. If a patient's calm, if I don't have the feeling they're going to erupt into agitation, I often tell them I'm not directly in charge, but my feeling is it's best to go to a psychiatric hospital. And if someone is likely to get agitated, they have a history of assaulting people, for example, then you want to probably make sure, as a consultant, I may in that situation not tell the patient my decision, and I may not have decided yet anyway. I may say, I'm going to finish writing, I'm going to think about this, or I'm going to finish writing and then talk to the emergency room doctor. So I may not tell a patient who's potentially going to get agitated what my decision is going to be, even if I know pretty much what I'm going to decide, because I don't want them to get agitated without knowing if the emergency room has staff available to, if necessary, medicate the patient and possibly even restrain the patient. So you want to gauge situations like that and try and make sure no one comes to harm. Thank you.